Namaskar, I am Abhibroto Karmakar, PhD scholar in Department of General Medicine, Kasturba Medical College, Manipal. Let's talk about the disease and try to solve the mystery of this disease in which females are predominant and multiple organ damage takes place. In this disease, there is lot of clinical heterogeneity. The disease is known as systemic lupus erythematosus or lupus. In this disease, patients are categorized into two groups, flare and remission. Flare when the disease is in active form, and remission is the inactive form of the disease. There are a lot of conventional diagnostic which uses blood, urine, tissues samples from the patient, but not a single test can determine the disease or help in the diagnostic. We live in the era of multiomics where we use the application of genomics, transcriptomics, single cell RNA-seq, proteomics, 3D genomics to solve this mystery. And what is the mystery? Is there any test or a diagnosis which can help us to predict lupus flare? The answer yet to be solved. So, what are we doing? We are developing a blood-based biomarker that can predict lupus flare. Lupus is an autoimmune disease in which our immune system is affected and our body cells attack themselves. To solve this problem where our immune system is affected, we gave immunosuppressive drug for the treatment which uses mycophenolate, cyclophosphamide rituximab along with the steroids. But problem lies many patient does not respond to these drugs. So the question arises, is there any genetic connection that does not allow the patient to respond to certain drugs? So what are we doing? We are stratifying our patient based on the drugs, based on this immunosuppressant. And as we are living in the era of pharmacogenomics, we are using this application for our patients and knowing what is the fault or what is the mutation or what is the polymorphism at the genetic level that is not allowing the patient to respond to certain drugs using SNP microarray, which will further lead to develop a patient-tailored therapy or a precision medicine in this field of lupus. Finally, our future goal and implementation of my research is divided into two parts. First, clinical goal is to treat to target in patient so that the patient should be in remission as long as they can with their proper and personalized treatment. And our molecular goal is to develop a panel of blood-based biomarker including microRNA, SNPs and proteins for lupus flare, because not a single test can determine this lupus flare. Thank you.